Let's review what to expect before, during, and after your surgery. Remember, you select me because my commitment, experience, and training will help ensure your safety. That starts with the preoperative workup, where we carefully examine your pupil under dark conditions using infrared technology to determine the pupil size and darkness. We carefully check for the dry eye, we check the thickness of your cornea, and we perform advanced mapping to determine the configuration of your cornea in order to rule out any underlying corneal conditions to ensure safety. Now, some of the preoperative workup may be done by your optometrist and the rest by us, or we may do all of the workup. At your workup, we may find that your cornea may be too thin, or your maps may be unusual, or you may be too nearsighted or too farsighted for safe LASIK. Accordingly, we may elect to either do the EVO-phakic intraocular contact lens, or PRK, or we may elect to remove the lens inside your eye, which is called clear lens extraction, also known as refractive lens exchange. Now, in some cases, you may just not be a candidate for surgery, and we may be unable to safely perform any type of surgery for you. I must turn away 4 or 5 patients a week because we determined that it's not safe to do the procedure. Remember, safety first. Now, let's discuss what to expect on the day of surgery. Well, first of all, it's quite cold at the laser center, so we recommend that you wear warm clothing such as a sweatshirt or a sweater. Also, you must bring a driver. You can't drive back from the laser center after your procedure. Plan to be at the center about 2.5 to 3 hours. When you get to the center, we'll have you do some paperwork, and then we'll give you a Valium, and we'll wait for that to take effect. Then we'll instill multiple drops of antibiotics, anti-inflammatory medication, and powerful numbing drops. We'll cleanse around the eye with iodine in order to help sterilize the area around the eye. I'm going to talk to you through the entire procedure, explaining each step along the way in order to make you feel comfortable. The surgery itself for both eyes takes less than 15 minutes, and believe it or not, there's really very little discomfort and actually no pain. Because the numbing drops are so powerful, you'll only feel a bit of pressure while we're making the flap with the femtosecond laser. Interestingly, you'll actually have a bit more pressure discomfort in the second eye because of anticipation. There's actually not more pressure in the second eye, but we sense that there's a little bit more pressure in the second eye. The pressure in either eye isn't too bad one way or the other, and it only lasts about a minute. Again, the procedure takes about 5 minutes per eye. After the procedure, we escort you to an exam room where we examine the cornea to make sure that the flap is perfectly centered, and we will give you both written and verbal post-operative instructions, and then you go home. After your surgery, I want you to go home and rest and relax and keep your eyes closed all day and all night. No watching TV, no reading, no working on the computer, no making phone calls, no checking your social media, no doing emails, no paperwork, just rest and relax and keep your eyes closed. Of course, you can listen to TV or a podcast or music, but the most important thing is that you let those flaps settle properly by keeping both eyes closed. Remember, safety first. So, what should you expect on your first day after surgery? Well, you either return to see us or return to see your optometrist. Your vision's going to be vastly better than it was before surgery without your glasses, but it's not going to be perfect. Some people describe their vision on the first day as looking through a veil of gauze or having maybe a little bit of Vaseline on their glasses. Now, your vision is going to be much better, but the edges are not necessarily going to be distinct or crisp. This is because there may be some dry spots on the surface of the cornea or minimal swelling of the flap, and this may take a few days to a few weeks to crispen up. Most people can drive to their first post-operative day appointment and plan to work. Very rarely, patients can't see well enough to drive or work on the first day, so you should have a driver lined up just as a backup, just in case, but this is very rare. Now, at that first post-operative visit, we'll check your vision. We'll carefully examine the flap, looking for any dry spots and centration of the flap, as well as any evidence of infection or inflammation, and we will go over your post-operative instructions once again. In some cases, you may actually need to be prescribed temporary glasses. That's if you're slightly overcorrected or slightly undercorrected, or you have a little bit of residual or induced astigmatism. In those cases, we may elect to prescribe glasses on the first postoperative day, or we may want to wait a few days or a week or so for things to settle down where we can get a more accurate measurement. You will need to wear those temporary glasses for about 3 to 4 months as the eye heals. Then, once the vision is stable, we can go ahead and perform an enhancement procedure to get you closer to your visual goal.